So, for those of you that don't know me, my name is Vanessa Joy Walker, and I have the privilege to be one of the co-founders of the Breast Cancer Early Detection Coalition and a founding leader of Women's Health Advocates. And we're just so grateful that you have decided to join us today to talk about, issues around early detection. I'm also joined by the one and only Liz Powell, and also one of the other co-founders who you will meet. There you are, Smita. She doesn't always love being on camera, but she looks beautiful on camera. So we're happy that she's going to be here and share a little bit about not only her personal experiences, but really how that propelled her into advocacy, because that's what we're all here. We harness our lived experiences, and then we want to help everyone use those to make changes. And I'll tell you all, this came full circle for me this last couple of weeks, and I was actually texting with Sheila, another co-founder, and Smita as well about this. I am a two-time breast cancer patient, and I've had some issues with one of my left implants, and I needed to have an MRI, scheduled the MRI, and they wanted to charge me $500 to have the MRI. And I couldn't afford the $500 to have the MRI, so I had to cancel the MRI. And if you think about it, like, this is the exact reason we're here, right? To make sure that women have access to all of the screening that they need from the very beginning to the very end. So it is with that, it is my pleasure to really introduce you all to Smita. I know you've probably seen her face before, but she is an incredible force. She has been really doing advocacy for some time now, a little bit informally, but now in a very formal fashion. And we are just so grateful for her contribution to our community. And so we're going to have a little conversation. Welcome, Smita.
Thank you, Vanessa. Hi, everyone.
Um, So, Smita, why don't first of all, I met Smita at the very first Hill Day we did for breast cancer, which was um, I don't even know when that was.
2024, I think.
Yeah,
I mean,
2024.
September 9th, 2024.
Yeah,
yeah.
2024.
Thanks,
And
Liz.
we became fast friends. And I realized this woman, she is going to make a difference. She means business. Um, but the reason why she came to this is like many people, through crisis. So as comfortable as you are, Smita, we'd love to learn a little bit about your experience.
Thanks, Vanessa. Hi, everyone. So, yeah, I actually I've never had breast cancer personally, but I've been a caretaker for three of my closest family, my first husband who passed away, my sister who also passed away, and my father who also passed away. So, um, my sister and my father passed away with late stage cancer. My sister was breast cancer most recently. And after she passed away, I think I was just trying to find, I was searching in the dark and I didn't know where to go really. So I think advocacy kind of found me, if I have to be perfectly honest. I was getting on every single breast cancer call that I could. And I think that's where I met Liz, I'm pretty sure. And that's when I got the email from Liz saying that, listen, we're forming this coalition. Would you be interested? And I jumped at that. And the moment I went on that hill, just, I had fun, to be honest with you. And after losing so many people from cancer, I was looking for purpose and I was looking to have fun in life again. So when I found the two meshed together on the hill, I was just taken. And that's when I became such a big uh, advocate of the hill, to be honest with you, because it gave me that power that I needed that I didn't even know I could have, really talking to lawmakers and just from from my heart, really. And then I had all these people around me that had um, had similar experiences. So it was beautiful, actually.
Yeah, thank you so much. And every time I hear, I mean, I know you so well now, and yet every time I hear you kind of layer out all of that you have experienced, it it takes me back a little bit because you are someone that, has such a bright light and you bring such passion to a room and to a space. And to do that while, being fueled by grief really is pretty, is remarkable. And what you have, how you have transitioned your whole life and your career to actually help change this for women is incredible. Um, Tell us a little bit, if you don't mind, about like your career trajectory and how, advocacy has kind of fit into that.
So after my sister passed away, I, started working for Nancy Brinker. And so she has a nonprofit called Promise Fund Florida, and she's just an amazing woman. So that's how my breast cancer journey started. And I realized after my sister passed away, that that was my mission in life. And just one thing led to another. And then I started working for UE Life Sciences, who, they've created this amazing device for early detection of breast cancer. And now we're also creating through Selfie, which is a similar device, but it's an at-home device for women for self breast exams. And we're literally digitalizing self breast exams and making it easier for women and fun for women to do it at home.
I
So
think
it's,
that's
it's
incredible.
something that, because one of the things that my sister and I think missed is that the education portion. So what happens if you don't get your mammos? Because we never really got our mammos until my sister got breast cancer. So that education piece was missing, and also the excitement of, okay, well, here's a fun device that you can use at home, and perhaps you don't have to go for a mammo, but initially you can use this at home. And then if you have a finding, then you have to go for a mammo, because remember, mammo is still the gold standard, and we still want to every year get our mammogram. But if we have something in between that, the 12 months that we can use, because that's when the majority of the breast cancers are missed typically, um, then that is something that actually is missing currently from the market. We just don't have that, and we're providing that through Selfie.
I love that. And I mean, I think you're being a little modest with the work that you've done outside of the United States and the impact you've had across the world when it comes to early detection. I don't know if you want to share a little bit about that as well.
So we've used iBreast exam on over 2 million women. And iBreast exam is now in 13 countries, and it's potentially going to be the standard of care in South America. So people are catching on, and it's typically in LMICs, lower middle income countries. So we realize that we can also provide something for women who, have the luxury of doing their breast exams at home, or we want that for them, basically. So we found a market there too, and we hope that Selfie can fill that.
You're such a great, amazing person. And if anyone on this call wants to meet Smita in person, you can come to one of our in-person Hill days, which Liz will talk about later. But we definitely want to invite you all to be a part of advocacy in real life, as much as you can do it in your home community as well. So if there was one last piece of advice you would give to anyone who really wants to jump into this advocacy realm and be a part of the Breast Cancer Early Detection Coalition or be a part of Women's Health Advocates, what would you tell them?
Never stop having fun. And I know this sounds crazy when you've lost someone from breast cancer or have been through it, and I just have that piece of advice for anyone in any walk of life. Never stop having fun. And advocacy was my ticket to do just that. And now I can have both. I could have a life of purpose, and I can have fun. So that would be my last piece of
I
advice.
just want to chime in here on this discussion. So I too am a huge Smita fan. And Smita, we actually go back several years because you were one of our first members of the Women's Digital Health Network.
Oh, yes.
And you and Leslie and several people kept talking about breast cancer. So we really directed a lot of the digital technology efforts around breast cancer. And that's where, my work with Sheila, like my worlds just kind of came together and realized we need to do this coalition. And the other thing I just wanted to comment on is what's so beautiful that I see in you and so many of the advocates who come to DC, I see across the country, people are turning their pain into action. And that's huge. That gives me goosebumps. And you know what? We can be joyful warriors. Of course.
Yeah.
If this isn't fun, like making a difference in the world, that's fun. That's joyful. That's amazing. And it comes from a very deep place. But it is so awesome. And I just want to thank you for being my teammate in this effort. You're a phenomenal role model, an advocate, and inspiration. So I just
Thank
wanted
you, Liz. Thank you so much. And always remember that whatever is fun, we want to do more of,
to,
Mm,
right?
yeah,
So,
I love that.
definitely.
And it is true. We have a lot of fun. The
We
last
do.
time we
yeah.
were all together, I said, man,
Yeah.
it's amazing how much fun you can have talking about breast cancer.
Yeah.
So, thank you. And that actually just gave me chills when you talked about that, Liz. I didn't realize that that's how far things went back with you and Smita. And it's just amazing how things come together. Well, with that, thank you, Smita. We want to really get on and
Thank
to
you.
tell you all about what's going on. It's a fast moving world here in DC, as you know, and Liz and her team at G2G have their finger on the pulse of everything that's happening.
Yeah. So we have a few slides to go over as usual. Um, and next slide, please. We always like to start off with our most important bill, which is the Find It Early Act. And many of you who dial in each month, I know you're familiar with this. And I appreciate all that you have been doing to support getting more co-sponsors for this bill, really elevating awareness around this bill. As a quick refresher, anyone who's new, basically in about half the states, a little bit more, you can get supplemental screening. So for women with dense breasts, which is up to 40-50% of all women, need, and I'm one of them, needs this additional supplemental screening, but it's not covered in all the states. And so the Find It Early Act would ensure that it's covered. So no cost to the patient to get what is absolutely essential. This is not supplemental extraneous. This is absolutely essential for women with dense breasts. You can't see it. It's like a snowball in a snowstorm unless you have this additional screening. And the form of that can be ultrasound, it could be MRI, MBI, molecular. So it's whatever the doctor recommends, but that additional screening is really important. And this bill is the most comprehensive because it covers it across the board, no matter what insurance you have. Whereas other pieces of legislation, which we'll talk about in a sec, we support that as well. We think it's great, but this is the best one because it is so comprehensive. Our champions, very bipartisan, bicameral. We have Senator Marshall, who's a doctor in the Senate, along with Amy Klobuchar, who introduced it there. And then in the House, we have Republican Congressman Brian Fitzpatrick and Congresswoman Rosa DeLauro, who, although not a breast cancer survivor, is an ovarian cancer survivor. So she cares very deeply about this and has teamed up with Katie Couric and other celebrities to introduce the legislation and really elevate awareness. The advocacy efforts that we're working on are increasing the number of co-sponsors. What's really important is that we talk to as many members of Congress and their staff as possible to educate them on the need for this screening, the need for this coverage, and then this legislation, and ask them to co-sponsor. And it really works when we do it from that constituent angle. So when you all come to Washington, or when we did the Zoom Hill meetings in October, those were really effective. We actually got more co-sponsors because you all did this. And Meredith Singer is one of our champions here in DC, along with Vanessa and me. We all live here. And she gets on the Hill and she pounds away. And she was telling me how in some of these meetings, the staff was like, okay, we'll be on. Well, they literally got on the same day that they did the meeting. So it really does make a difference. And it's a constant drumbeat, a lot of repetition. You got to educate, come circle back again, circle back again. So it's never, rarely one and done, which I think makes it challenging, for people, in the business world. Maybe you're used to just getting things done quickly. It's just not how our legislative process works. So y'all got to stick in it for the long haul, and keep up this education. We're also working to educate agencies. Agencies are really important. For example, the HRSA agency within HHS came out with a regulation last year, or a guidance, I should say, that was clear about the need for the supplemental screening. So things like that, we are trying to elevate as much as possible. And interestingly, some of us were at the Women's Health Conference that HHS just did in March 11th through the 13th. And they talked about how they were proud about a new guidance around cervical cancer and HPV, but they didn't announce the guidance on breast cancer, which was really annoying me. And as soon as I saw that, I was texting one of our fellow Breast Cancer Early Detection Coalition teammates. It was like, wait a second, we need to adjust. So we're going to work on a follow-up letter actually to point that out and make sure that they elevate that as well. So there's lots of work to do. It's a constant nudging process. And so when you hear us talk about this every month, there's a reason, because it's really important that we just keep at it, keep educating, making this the focal point of all our efforts. Next slide, please. I also want to thank you because your letters have made a big difference. So we have a letter writing system on our womenshealthadvocates.org. And if you click on that, it says you can send a letter, and you click on that, and then you can pick which topic you want to write a letter on. So we have the Find It Early Act letter, 171 letters. We have the Support the Breast Cancer Legislation to Save Lives, which is an additional letter, 206 letters that you all sent in. That makes a big difference. And I will tell you, I looked at the number of co-sponsors. So back in February, we had 49 co-sponsors in the House, 6 in the Senate. And today there's 53 co-sponsors in the House, and there's 9 in the Senate. So we are inching our way up. And I know we'd love to see it quickly go to 100, but it's just going to take time. And so to stick with us, keep doing those letters, keep participating in our Zoom Hill meetings, our Zoom events, and our in-person Hill days. We really, really want you to share your story, share your voice. It really matters, and it really does make an impact. And I will say, for this upcoming May 21st Hill Day, which I hope you'll all sign up for, I'll put the link in when I stop talking. I hope you all can come. And the way we do those Hill meetings is that people, when they introduce themselves, they have a little bit of time to just say something about why they're there. So if you are a breast cancer advocate and that's your issue, then that is what you talk about. So even though it's called the Women's Health Hill Day, I want you to feel empowered and welcome to say, I'm a breast cancer survivor, or my sister, or, whatever your connection is, this is most important. Please co-sponsor the Find It Early Act. We'll do trainings to prepare people for the Hill Day, but I just really wanted to emphasize that we are very passionate about people and women's health advocates leading with what drives them, what is at their heart that's making them so actively engaged in advocating on women's health issues. So I think that's it for my slides. Is there another one? Remember? Oh, yes. So this one, as I mentioned earlier, there are other bills out there, and we definitely support them. We are collaborative with all the different breast cancer groups out there. We support all of this. It's just the Find It Early Act is more comprehensive. So we are tracking these moving forward. None of these have passed yet, but we will continue to track these as well. And I think now I'm done. I think I'm passing it back to you, Vanessa. No, I'm not. I keep doing that. Okay, so one other issue that we've been working on is stage 0 cancer. So some of you probably know this very well. So in stage 0 cancer, you don't necessarily have to do that follow-up radiation therapy, which can be very toxic, especially when it's not needed. Something like 80% of all patients get it, even when it doesn't do anything for them. And it actually is harmful. So we have been working on an effort to educate members of Congress on this issue and the fact that the coverage, again, it's always coverage, is at risk. So just as we have started to change the standard of care so that we do a test to see likelihood for cancer and if you need that follow-up radiation or not, we've now started to get coverage for that across the country. But now there's an effort to pull that back and deny coverage, which makes no sense. So we've got a whole effort. We've been doing letters and meetings with the CMS and HHS folks, as well as Capitol Hill, to nudge that forward. And we even are working on appropriations language that would help with that as well. So we've teamed up with Prelude DX on this one. They are a member of our steering committee and really doing an amazing job to try and help women. So that's another legislative issue. And by the way, if folks have other legislative issues, please reach out to me. You can pop it in the chat box now or reach out to me directly, or the team, or me and Vanessa, the team. because we want to know about these other issues that pop up. Not everything is legislation. Sometimes it's just a letter to an agency or a phone call or just elevating on social media. We've got amazing social media followers. So there's lots we can do to elevate these issues. So next slide, please. All right, now I am passing it back to the one and only Vanessa.
Um, so we have lots of stuff that's upcoming. One of the things that isn't on here is, and I'll just mention this, showing up wherever we can is important as well. And some of us will be showing up at a Hill Day that isn't our Hill Day, but I'll be wearing my breast cancer early detection shirt at the Komen Hill Days that are coming up at the end of April. And it's, showing up wherever it is that you can show up is important. We're super excited that we are doing two pilot events with the Chief Clubhouse, one in DC and one in Chicago. This is a members only clubhouse for women. It's kind of like a We Work for women. And we're going to be doing this educational event with My Density Matters, Prevent Cancer, and the Brem Foundation, really around advocacy and education. We're going to pair those things together. And this is something that we can replicate. I see Bethany, I see her face on this call, and we did something at her organization that's similar in a virtual manner. But these are things that we can replicate. So if you have somewhere in your community that you want to think about doing an event that marries advocacy and education, we want to talk with you about that. A lot of really interesting stuff is happening in North Carolina. I encourage you to follow along with one of our co-founders, Sheila Ann McHale, on LinkedIn. We'll also put some things in the chat about that. May 13th is the Chief Clubhouse event in Chicago. May 21st, of course, Liz already mentioned, is the Women's Health Capitol Hill Day, followed by the Illuminators event, which is going to be a really interesting and exciting gathering of people from all different areas of biotech. And where else, Liz? Help me out here.
Yeah, so the conference actually we flipped the dates.
Okay.
So that's my bad. I didn't catch that. So May 20th will be the
Right.
Illuminators Conference, and it's a half day conference. And it's basically all these experts in the stages you have to go through for a company and navigating government to bring your innovation to market with the focus on women's health. So breast cancer technologies are definitely part of that. And risk assessments, those types of things are definitely part of this dialogue. But the focus will be on funding, how to get funded. Second, how to get through the FDA regulatory process. Third, the whole reimbursement challenges, as we keep talking about. And then fourth, market adoption and access. So we're going to have these different panels, and then we're going to have a great keynote by Megan Greenfield with McKinsey talking about that all data on these gaps in women's health and where we're seeing the greatest opportunities. So she does a great presentation. We have some other interesting folks. We're working on some members of Congress coming over. So it'll be a great half day of really interesting insights, networking. So I highly recommend it, especially those that are on the business side. Although I did get a question like, is this a place for nonprofits? I'm like, it could be. It could be good networking. You might get potential donors. The other aspect is the funding part. That applies to nonprofits. A lot of institutions need to be getting funded, especially now that things are tricky. So we will be covering that too. So
Yeah, it's going to be a really great event. And one of the things I find, even though, I don't work in that space, I find it so interesting to be there because knowing about that is so important because it's a part of the ecosystem, right? I mean, if we don't have the innovations, then we don't have the early detection, and we have to be, it all works together. So it'll be really interesting to hear all of the great speakers of that day. Um, we're going to be doing an online congressional briefing. We don't have a date yet, I don't think, but we'll be doing it. It'll be similar to what we did last year, which we had an incredible online briefing for the breast cancer, for the Find It Early Act. We'll give you more information about that when we have it. And this year, the women's congressional softball game is actually in September. Last year it was in July. This year it's going to be in September. And so we will be having our in-person Breast Cancer Early Detection Coalition Hill Day in September around that event. It's going to be fun, to use Smita's words. Last year was just, I mean, it was just so much fun. It was so great to be together. We had so many meetings. We made a lot of progress. And I believe that we will do the same. And I am going to say that by September, we are going to be so far ahead with our sponsors and our co-sponsors that we're going to be celebrating maybe with champagne. And we're going to be doing advocacy trainings. We understand this is something we heard a lot of last year, that people want to know more about, well, how do I do this? And not just, what are the pieces, but how do I share my own experience? How do I do it in my hometown? What are the different ways that we can do this? And so we've heard that, and we are going to be having more advocacy trainings. Next slide. Um, Also, very exciting. My vote, our health. So if anyone didn't know, this is a year that people will be voting. Um, and so we know that your vote really does matter. We saw that if you were on our call last month, we had Sheila come and share a little bit about what she is doing in North Carolina. I encourage you to go back and watch that video. It will inspire you to take action. And Liz has put together an incredible people with other partners beyond the paper gown, Community Catalyst, the Menopause Foundation, and Women's Health Advocates to really talk about why voting is important and why it has to do with why it directly affects our health. Liz, I don't know if you want to kind of share a little bit about that briefly.
Yeah. So definitely my vote, right? So it's my vote, capacity, but it impacts all of our health. That is why we have that title. So all of us are impacted on how we vote in this election and in every election. And so what we're trying to do is real voter education on what are the key issues that are out there, what are the policies that are pending, and how does who we vote for connect to that? How do we connect those dots? And this is not partisan. It's just about which candidates, which politicians really make women's health a priority. What, for example, who are the co-sponsors of the Find It Early Act, right? So it's making sure that we're connecting those dots to how we vote. And our first in the series is coming up very soon, actually, April 23rd. And Vanessa, our very own Vanessa, will be one of the speakers. Very excited. Jocelyn Fitzgerald. We're lining up some amazing speakers. Linda Goler Blount will be leading it. So we're working on getting final details out. So we will be sending that out to everyone. But please sign up, and you sign up once, and don't have to do anything again. It will be on your calendar. It's the same link every time, so it'll be very, very easy for you. So please join and help us spread the word about it. Thanks.
Next slide. We already talked about this a little bit. Contact your member of Congress. You can go to womenshealthadvocates.org. There are a number of letters that you can personalize and send in. We certainly encourage you to do that. It's okay to send in a letter more than one. So don't think that just because you did it once, you can't do it again. You definitely can. And encourage other people to do it. This is something really easy for people to do. Share it with your community, your church community, your PTA, your Soul Cycle group, whatever group it is that you're a part of. This is a really easy way that people can get involved. A lot of times, especially when so much is going on in the world, what I hear from people, and I don't know, Liz, maybe you do too, is that like, oh, I just overwhelmed. I don't know what to do. And it feels like you have to do something really big, but this is something you can do. This is something everyone can do. So I encourage, if you hear that conversation happening, tell people, take a screenshot of this QR code, have it on your phone, and say, hey, you can do this. This is something you can do today. Next slide. So you can keep going. Really, we want to encourage people if you want to be a part of the steering committee or join the executive committee. This is a place where, really where the sausage is made, right? Where all of the things that we are doing um, get discussed, the policies, the events, the initiatives we're going to attach ourselves to do. We can't do everything, right? Um, it also gives you an opportunity to highlight, your voice and also perhaps your organization. Uh, and so there are ways that you can get involved. We encourage you to go to our website and find out more about joining the steering committee. It's a great community, and it's a great place to amplify your change. Next slide. As always, we want to thank our sponsors. I love that we're getting more of them. We can't do this work without sponsors. This work, all of the stuff that happens behind the scenes, it takes resources, and so we're so grateful for the resources of the organizations that have contributed, and we're also grateful for the resources that all of you have contributed through your time and through your energy and through your lived experiences. I think that's it. We're 3 minutes over, but I think we did really well. We had a lot to cover today. Of course, if you have any questions, please reach out to us. Please follow us on LinkedIn, Women's Health Advocates, the Breast Cancer Early Detection Coalition, and also on Instagram, Women's Health Advocates. This is where we're sharing a lot of information, and we also want to share what you're doing. If you have a nonprofit, a small nonprofit, or a community group that's doing some advocacy work, we want to know about it. We are here to highlight and amplify what other people are doing around this country around breast cancer, early detection, but also around women's health in general. So we are so grateful. Email us your questions. And I saw something in the slide that said, hey, can you put some of this data and this information up on social media? Yes, we will. We will slides into some sort of a carousel, and we will put them on social media so that you can share it. I think that's it.
Yep, I think that's it. We're off to our steering committee call. So we will see steering committee folks on a separate link. Thank you all for dialing in. We really appreciate you and appreciate your advocacy.